Is there really a healthcare crisis in this country?
Well, healthcare is certainly in a crisis, and I think if you were looking at it from a physician point of view, we're in crisis. From a hospital point of view, we're in crisis. Medicare is in crisis economically. There's too many uninsured, which create pressure on everybody. I think business now believes we're in a crisis because too much of it is being picked up by business in terms of premium increases. We've got technology increased costs. We have pharmacies and pharmaceutical distributors and manufacturers making very, very large profits, but probably justifiable from a research standpoint. And in some ways, we are the developer R&D for the entire world, in essence, and American citizens are picking up the tab for it. So it's a very, very big issue, and it's a very complicated issue.
So, Chris, you have been an outspoken supporter of California Governor Arnold Schwarzenegger's health care reform plan. Why is that?
Well, because he's about the only elected official I know of that's really suggesting a public-private partnership. There are a lot out there that are playing to the public by saying, let's create a single-payer system. We'll have uniform and unified and health care for all. Well, the reality to that is extraordinarily expensive. I think we have, and I've studied the healthcare systems in Canada and Great Britain and in Europe, and these are individual citizens that have grown up in a kind of a socialized healthcare system where queues really are the name of the game. You don't apply for healthcare or try to get an appointment and expect to get a healthcare appointment tomorrow, and you certainly aren't going to get elective procedures tomorrow. American citizens expect everything today, and they expect the highest level of technology, whether or not, frankly, is really required in their case. So I think if you think back on managed care, when people had to go through a primary care physician before they could gain access to a specialist, and it got to the point where Jay Leno and other talk show hosts were making jokes about waiting 2 weeks to be able to get health care. Well, that pales in comparison to what it would be like if we had a universal healthcare system where literally it could be weeks to months, in some cases years, to get access to healthcare.
So what role, Chris, do you believe that hospitals play in disaster preparedness planning?
When we worked with the Surgeon General, Richard Carmona, and he called us and said, Chris, it's never been done before, but can you put your Scripps Medical Response Team, which we designed really for only regional response, he said, could you send them to do relief for Hurricane Katrina survivors? We said, sure, if you give us enough time to do that. And we got a phone call on a Saturday morning, said, can you be in Houston to relieve the University of Texas Medical Center in 24 hours? Frankly, we did. We sent ultimately 80 doctors, nurses, and I went for 2 of the 3 weeks to do Hurricane Katrina relief. And I think that put us really on the call it on the map in terms of disaster preparedness nationally. And as a result of that, we started working then with the state of California, and we're well involved from a county perspective in terms of preparing for disaster preparedness.